Assalamu alaikum wa rahmatullahi wa barakatuh. A very good day to you. I'm Hawa Solomon. In this edition of Pregnancy to Parenting, we're reaching our new season, and what a phenomenal seasons we've had in the past, looking at finding a partner, what right partner to choose, trying to fall pregnant, fertility, going for our first antenatal visit, finding out that we are pregnant, to the stages of pregnancy, to having the baby, now focusing, and even taking baby home, now focusing on mom and baby bonding. Often this sort of process is taken for granted, and we don't quite realize that as much as it is natural, it can be stunted. In studio we have two guests to talk to us on this topic, one at least both from the Parent Center, one being a professional psychiatric nurse in private practice, as well as doing sessional counseling at the Parent Center, and that is Sister Julia Noble, and Blanche Riesand from the Parent Center, who is the Infant and Parent, or Parent and Infant Program Manager. A very good day to you, ladies, and thank you so much for joining us.
Yes. Thank you for having us, Kara.
Only a pleasure. So, to you, Blanche, as well, very good day to you, and thank you so much for joining us.
Thank you. It's good to be here.
So, firstly, let's just quickly establish some information about the Parent Center. Tell us firstly who the Parent Center is, because both of you are representing the Parent Center here today, and this program did come about. Programs that the Parent Center hosts. So, Blanche, if I could start with you, quickly describe to us and tell us who the Parent Center is.
So the Parent Center is a long-standing organization established in 1983, and I think our work has really been around preparing parents to work with children. And because there's no manual that comes with that.
No.
So what we do is it's about building skills, it's about building that relationship, and making sure that you're actually reducing child abuse, neglect and maltreatment in the long term by forming good relationships between parents and their children. So that's the Parent Center's objective in a nutshell. There's a range of programs that we kind of engaged in, from antenatal, so the program that I do, parent-infant intervention programming, right through to the 0 to 3, a specialized program around counseling, so it's individual counseling, right through to parenting and leadership, that is actually training. And we work right through support groups in various areas, and just really building capacity and support for parents in communities, disadvantaged communities, but also the affluent communities, because we have mom circles at the different hospitals, and I know Julia's been quite involved in that area as well.
Thank you so much, Blanche, for that information. Looking at the program that you have and that you hosted specifically for parent and infant moms, would you say that the bond between mom and baby does and supposedly comes naturally?
Well, I think there's an expectation that bond does come naturally. I do think the bond starts from when baby is inside mom, and definitely how that pregnancy is experienced definitely plays a role as well. I'm sure Julia would be better versed in understanding and giving us some information around that as well.
Yes, Julia Noble, our psychiatric nurse, professional psychiatric nurse, and also counseling, sessional counseling work at the Parent Center. Tell us that natural bond, that inverted commas, as we context it as.
Well, I think that always puts a bit of stress and strain on it, doesn't it? When we have these high expectations of meeting the baby for the first time, and then having this sort of wonderful magic that might be between. But in actual fact, it's not always. I think from an evolutionary perspective, baby needs to survive, so baby is going to be having some interaction with mom, which will facilitate some bonding, but it doesn't always come naturally, as we say in inverted commas.
Okay, so that needs to be cleared out, but out in the open, in the air, it doesn't necessarily come naturally.
Not necessarily.
Okay, so then that brings the question, what if it doesn't? What next? Now, where does mom then move on to? What are the supposed feelings that she's meant to feel? Does it now mean that there's something wrong with mom or baby? Guide us through that.
It's always very important, I think, with mothers in those early stages, mothers and fathers. I mean, both of these parents are extremely nervous. You've got your grannies, you've got the rest of the family who's standing by. And I think, just repeat your question again.
The fact that is there now something wrong with mom or baby because this hasn't quite happened?
Okay. Not at all. Not at all. I think if we come from a standpoint of understanding and not too much pressure to have this bonding happen immediately. You know, bonding takes a while. Bonding is like forming a relationship, really, isn't it?
Yes.
So
and that takes years.
Absolutely, absolutely. So we need to just, learn to get to know this person, this new person that we haven't met before. So yes, we can have a connection. We can feel strongly about the new baby, but the bond itself, or that feeling of specialness, that feeling of communication and being in sync with this other new human being might take a while.
So when what I mean was with regard to that there's something wrong, because that's usually the first thing you think. What am I doing wrong? We've established that it's not natural. It's built. And yes, there is sometimes the interaction with mom that just inherently comes, the feelings that you get between mom and baby. So when if there's something wrong, that's usually what we say. That's the first target. We're saying, let's have baby checked out. There's something wrong with baby, or there's something wrong with mom. So what would you say are the guidelines that one should possibly look at? Maybe the terminology is not used correctly in it's like there's something wrong, but there's maybe some concerns. So what could be the possible concerns, and we'll look at the treatment and therapy in the way ahead a little bit later on.
Yeah, I think obviously, and Blanche can give an opinion on this as well. Would be if baby and mom are not in sync in communication. So you might see things like baby will be pulling away, but mom doesn't notice that.
Yeah.
So really, it's about picking up the baby's cues. Baby's smiling, but mom's looking the other way with her cell phone or whatever it is. Yeah. Sometimes we can pick up that, or if mom feels that baby is doing things to anger her. Very often mothers who are very anxious, or perhaps have a bit of a background of anxiety or depression, or just feel overwhelmed by the situation, sometimes they will assume that the baby is doing things on purpose. And sometimes that can lead to
that's where the terminology comes in of doing something wrong.
I think it's really about communication, because when you're forming a new relationship with someone, with a partner, or with anybody special, you want to be able to speak to them. You would want to be able to just engage with them, hear from them. And I think with baby it might be a little bit difficult because baby's not speaking. So mom has to use the non-verbal cues because that is the language. And I think that's where it becomes a little bit difficult when mom is not able to, as Julia said, pick up on those cues, on when baby is hungry, when baby is just needing a bit of a cuddle. So that is important, that those non-verbal cues are.
I know that there are professionals that it takes years for them to even recognize baby's cries, baby's involvement, baby's movements, baby's and I watched a talk show once, and this lady was able to speak baby language just listening to the pitch of the cry. So you know what, there are professionals that takes years to get through that, and we smack bang with the baby and we mean to understand it. So let us process that understanding of it. It's not coming naturally. So Dad, his involvement with regards to bonding, talk to us about when Dad should be bonding with baby, because now this is also once again a process, and unfortunately we don't quite put it in that box, in that context. It's just like mom it takes a while to bond with. I'm sure Dad does as well. So talk to us about how a dad can also bond appropriately with baby.
I think in a traditional society, what we have is that previously used to have dad's waiting room, when the birthing process was taking place, and dad would wait to be told he's a dad. But lately, fathers are becoming more involved in the actual birthing process.
Yeah.
And I think even from when mom is pregnant, that's when dad should start playing a role in terms of support, talking to baby, rubbing the belly. I think that's where you're forming the bond and the attachment already, where the baby can actually hear the rhythm of that voice and the depth of that voice actually before that child is even born. And I think that's an attachment and a special time for mom and dad as well in preparation for baby. So dad's role is definitely important. In the families that we are faced with in our society today, it's not the traditional, nuclear family, the ideal family where everyone's in one home. And that does place a little bit of strain just on building that relationship. But it is important to involve dad at every stage. Whether it is that dad would burp baby once mom has fed baby, but there has to be a routine, a conscious, I think it should be conscious, that dad should be involved just in building that relationship between himself and baby as well.
Yeah, no, we will get into the involvement of dad later on when it comes to parenting, because just recently I was chatting to someone about, dad being there, very much there, but being absent. Like you would, the suggestions of, being interactive with your children. And it was said, no, but I'm here. The dad said, but I'm here all the time. So yes, you might be there and you might be around, but be active in your action. So that's what we want to talk about when it comes to bonding. So the program, quickly before we delve into more about mom and baby, how they bond, tell us about your program at the Parent Center.
So the program that I manage is the Parent Infant program. And what that is it's built around supporting moms, providing the emotional support to moms while they are during and antenatally first and then postnatally. So what we do is we provide 5 antenatal sessions where it's actually an at-home visiting program that actually goes to the mom's home in the comfort of their own space and actually just works around preparing them. What are they feeling? What are their fears? Some of their thoughts? Even preparing siblings for the arrival of the new baby and helping mom negotiate that with, because there can be some sibling rivalry with this new baby now that I've had all the attention, and so we prepare mom for that. What does happen also is we have the 5 antenatal sessions and then the 15 postnatal sessions up until baby is about 6 months old. So these services are rendered by counselors, lay counselors who actually come around in various areas from Hout Bay to Mitchell's Plain, Izamuyetu. We've got retreat in the retreat area, Kailicha, Nyanga, Philippi. So if you want more information, we could definitely, our contact details will be there just to find out where they can get the support. We do clinic talks as well at the various MOUs. So actually just giving them an insight into the program, support and some information, because many of the times we don't know what's really happening inside our bodies. And I think that support, knowledge and information can settle you, and you can be less anxious when you know what to expect. I think the age-old book of what to expect when you're expecting is really, knowledge is power. So once you're more informed, you kind of can say, okay, I'll settle my nerves a bit. I've heard from that lady that came to visit me that was my support. I heard from her that this is a normal, these are just pregnancy niggles, or this is what I'm going through. And there's somebody I can speak to on a weekly basis that can come and ask me how I'm doing. And they're just offering that emotional support is important for mom. Julia will share with you the program she does. She does 0 to 3, an individual program that focuses on 0 to 3 years old of development.
We'll chat about that a little bit later on, but more on mom and how mom, or even how baby is bonding with mom after the short break. Stay with us. Assalamu alaikum, welcome back. A very good day to you wherever you find yourself around the world in Africa, and we are broadcasting live from the tip of Africa in Cape Town. Thanks so much to individuals representing the Parent Centre based out here in Cape Town, Wynberg. I hope that wherever you are and you are in need of information when it comes to mom and infant bonding, there is a centre near you, and of course if there is a clinic, go and speak to your closest nurse or clinic sister about this issue. Highlight it. It's happening every day, and as we just said before the break, Blanche and Julia in studio with us saying that we didn't even realize that, but yes, baby bonding between mom and baby doesn't actually really come naturally. The same like dad feels uncomfortable about just holding this tiny little baby, the same can be for mom. So next question for me is with regards to bonding, and we don't we say it all the time, you know, do we really understand it? So when baby is there, baby is another being, he's another creation, another person. How, and his body and his or her body is also working. So how would you say, at least explain to us, how does baby bond or at least interact with us? All we know is that baby cries. So baby's hungry, baby wants a bottle, baby wants a cuddle. So how is baby bonding or interacting with mom specifically?
Okay. Well, I think that's it's a very important question, and I think what happens there is that one must just realize and remember that this is the first relationship that baby's having.
Yeah.
So although baby has been having a relationship with the mum from the point of view of the womb, and dad, hearing dad's voice and siblings' voice and the rest of the family, when baby's born, this is the very first relationship. So baby will have cues like crying, baby feels uncomfortable, and it depends on how the mum reacts or whoever's looking after baby, because we know in this day and age sometimes it's not the mom who looks after baby. So we need to just say whoever is the caregiver, the primary caregiver of baby, what is that relationship like? Is baby learning trust? Trust is one of the most basic things that babies learn. And can I trust another human being? So when I cry, is someone going to come and comfort me? Am I going to get fed? Is my nappy going to get changed, or am I going to get cleaned? Am I going to have soft words spoken to me, or harsh words, or what is my world going to be like? And then in that way the baby can respond, and the baby will learn from its cues how to respond then to that.
Okay. So baby is communicating via their gurgling and mostly through the crying. I'm sure you probably have to listen to the pitch and strength of the cries as well to discover, you know, is this I'm in pain or is this I'm tired as well. So it's mostly the gurgling and the touching, even reaching out.
Absolutely. That's how baby starts to ask for something, because as Blanche mentioned earlier, you know, it's a newborn baby. They're not going to be able to put into words what they're feeling, and it's really up to us. And it's very helpful as well if moms and dads, whoever's looking after baby, can actually verbalize that. Oh, you're hungry. Oh, you're tired. You know, that's your tired cry, that's your hungry cry. And this is something that doesn't come naturally. I must just emphasize that, because it takes a while to learn which is the hungry cry, which is the tired cry. So, yes.
Blanche, your comments on how baby interacts with mom or with the rest of the world, in fact.
I think what's interesting is that what we do need to constantly remember is that baby is attached to mom via an umbilical cord during pregnancy, and there's this lifeline there. So I don't need to do anything. I can just kind of swim around and I'll be okay, and it's just about me, and I'm warm and everything's fine. And then there's just the sudden detachment, this birthing process that can be traumatic for mom, it can be traumatic for baby. But I do think that's when it actually kicks in, that somebody, now it's going to kick in, now this person that's taking care of me now needs to show me that, like Julia said, I can trust you. You're going to come when I need you. And when I'm feeling this wet feeling around me and I'm cold, and when I gurgle or when I do anything, that I'm going to get a response. Your face is going to show it. Your eyes are going to show it. And I think that's important, just to pick up on those non-verbal cues as well.
Okay,
absolutely.
So as we talk more and more about the unnaturalness of the fact that it doesn't really happen that way, but sometimes it does as well. And you know, then we have to really be thankful to the Almighty that it has happened, and be grateful, because everybody doesn't always get that privilege. So the Parent Centre, I just want to chat quickly about why the focus on mom and infant bonding, and that's why I said what I did earlier now in the program. Why has the Parent Center specifically also chosen, mom and infant bonding? Because usually, like we said, natural, no, yes, it's still, and we still need to workshop that, and we still need to discuss that and make people realize that this is not something natural. Yes, the Almighty has given us an inherent women responsibility of feeling, to love and to be be more emotional, but it doesn't happen with everybody. Everybody is different. So the focus, just explain quickly how was that latched on by the Parent Center, that this is a much needed program to introduce to the community?
I think through various studies, studies have shown through many years ago, starting from Donald Winnicott, who was a pediatrician and then became a therapist, and then many other studies after that have just shown how the attachment, that first attachment, really does equip us for the rest of our lives and the rest of our relationships, and how we manage our lives from then on, psychologically, how it affects our mental health. So because of that, we've seen that we can reduce sort of drug addiction problems, we can reduce all kinds of social ills, and just create a better quality of our mental health through attachment.
So science is proven.
Science has proven, absolutely, yes.
The need for it. Yes. Okay, so does siblings often play a role in the stunt of the bond, or possibly, create a distraction or negative, even positive bonding between mom and baby, and specifically mom and infant bonding?
I'll
siblings.
Say 2 words on that, Blanche, first, and then. So I would say, from the experience in our 0 to 3 counselling, our specialist counselling that we offer at the Parent Centre, we certainly do see that. Sometimes what happens is that mom has already formed this relationship with the other siblings. So sometimes it is tricky, because now you've got this new baby who you haven't quite yet formed that relationship with. You have guilt. Siblings are of course very jealous. It's like having someone new in the home. I'm not getting in the attention, so that can also affect things. But I'll leave Blanche.
I think what's important to remember as well is that not just the jealousy. Sometimes siblings can be excited, and so they kind of, I'm going to do this for my brother, I'm going to be a big sister, and that can be lovely, and for you to involve them and acknowledge their feelings just right through the process is very important. So actually to say, this is going to be your responsibility. So if it is to take and fetch and to actually lay baby down and open up the blanket, to actually get them very involved from the beginning, gives them that responsibility, and they feel as if, oh, it's my baby, because that's the ownership that starts to take place. It's my baby. So when family come over and they say, can we take the baby with? And like, no, you're not taking the baby anyway, because now this bond is then formed.
An attachment
has formed. That belonging has formed. This is mine. So I think what is important is to get that going from the beginning. To actually say, I'm very firm when we do the program with the parent infant, we actually say to mom, let the sibling talk to the baby. Explain to them what the baby can hear and can't hear. And so that they can also say, oh, you coming? I'm not too happy that you're coming. You're taking my space. But we're going to have to see how this is going to work. So actually starting there,
I add to what Blanche is saying, because I think that's so vital, what she just said, because what that does is it also means that mom is then verbalizing perhaps some of the things that mom's also feeling, because mom's also feeling a sense of loss. While she's had both her baby, the siblings, and this new baby as well, and that just also helps her to have an easier environment. If the siblings are understanding what's happening, then of course her environment is easier, and then it's easier for her to bond with the new baby.
I think what comes out for me now, learning about your program, because you kind of using examples of what's happening within your program to enhance the mom and baby relationship, and now discovering that this is not necessarily a natural bond or relationship, or just an emotion that spurts out and happens. So in fact now comes the next question, and maybe advising our moms and dads, grannies, parents to be that about this course, and should we be even attending something like that to educate? Like we said, we don't have a manual to parent or to show us how to parent, so should we be teaching ourselves how to be bonding appropriately with our babies? Talk about that suggestion. When should it appropriately happen as well, while you're pregnant or already after birth? Guide us, please, Julia, or
I've noticed that in the antenatal classes, if people can go, look, I think it is just the privileged few sometimes that are able to attend something like that, but very often it also helps dad, because we are socialized very often from the past that dad is not always immediately involved in the story, and it's a way of just getting the family more involved in that. Blanche,
I think what is important also to understand is that there are services out there in different areas that can really help you before, like to try and prepare yourself. Like I said, knowledge is power, so prepare yourself on what to expect. When I'm feeling strange, who can I call on, who can I make contact with? And I think with the Parent Center, what we've done is we've made sure that we've got 16 support groups right across the Western Cape, where you can actually, there's not a duration, it's not like you go there and it's going to end. Actually, some of the support group members over the years, they've been there for 2 or 3 years, have even decided to go back to school. They really get that support where it's not just about saying, I'm learning parenting skills, I'm a parent. Sometimes the response is no, I can do this. I can figure it out on my own. My parents have, so I will. But I think the value in those support groups going for that assistance is actually the support. That you're not alone. That you don't feel like, oh, it's just me. I'm struggling. I'm single mom, or I'm not getting the support that I'm required to get, and now I feel like the world is so heavy. That support is really important. And if you yourself are calmer, you can parent in a calmer way. But if the stresses are already there in socio-economic circumstances are not that good, you're already stressing about finances. You're already stressing about so many other things that you're worried about, besides just having to bond with this baby that's now needing all of your attention as well. So those support mechanisms are around where you are able to say, I'm tired. Can I get 5 minutes, please? So there are those support mechanisms as well.
And then it's okay to have the 5 minutes, to actually give mom permission to say that it's okay. I must just sing the praises of the Parent Center, and this particular program that Blanche is heading up is that these counsellors go into the homes, and when you go into someone's home, you really see what's happening in the home. You see the siblings, you see the granny, you see the auntie, you see how the brothers and sisters, etc., are operating with each other and what their relationship is like, and that's where you can really do some amazing work.
Ladies, we're getting into this conversation. It's so much fun. We cannot stop, and more questions comes about. I don't even think I'm going according to what what we put down and set down. So this is really exciting. Mom and Infant Bond Program available at the Parent Center. And we will help you better bond with your baby and parent better through this program. More after the short break, so stay with us. Assalamu alaikum wa rahmatullah. Welcome back. Good day. This is, of course, Pregnancy to Parenting. We're dealing with mom and infant bonding. Sometimes it's also parent bonding, because that's what the program is called at the Parent Center. They've hosted it for many years. You're the based here in Wynberg, Cape Town. I have with me a sessional worker and psychiatric nurse, Julia Noble, as well as, I get this wrong every time, so let me just think about it. It's Blanche Resent.
That's right.
Resent. And she is a program manager for the infant and parent program at the Parent Center. So thank you so much, ladies. I must honestly say I'm having so much fun, not just getting information across, but realizing that, you know, with all of this you learn, and no matter how much children you've had, you can parent till you are literally in your grave, and this helps even a person that you're sitting next to in a bus or a taxi, or somebody that you've just met at a function, sitting at a wedding, or even in a mosque, just to get that information and realize. I know, Julia, we spoke recently and just about positive affirmation to a mom could even help with that bond. So let's learn through your program how effectively we as adults can communicate with an infant, a few hours, a few days old baby, how we as adults can effectively communicate with that little one.
I think in the parent-infant program, we actually have time where you actually teach mom through baby massage.
Okay.
That touch is important, and the facial expressions and understanding that I'm here for you, and it's just about the two of us in this moment. So I think that is what is important, and the massage techniques. And just saying to mom, it's okay to take that time out, that we make that moment important. And that I think Julia mentioned earlier as well, sometimes we are distracted by social media. We want to go onto Facebook, we want to get onto Twitter, and when we're breastfeeding, we want to try and find something else to do. But in our program, we really encourage moms to be present. To be present, to be there, and to actually look into baby's eyes, make the eye contact, and actually say, this is important. This moment is important for the two of us.
And I think, just to add to what Blanche is saying, not to worry too much about, with baby massage. It doesn't matter if you don't have the correct technique. It's about just being there, absolutely being present, and sometimes just following one's own feeling in that moment between you and baby.
And that touch, because like you worry, am I doing it right? Did I use the oils or the creams that Granny suggested? And
I think what's important is also that there are so many remedies and advice that you get from different people that is like, no, you must use this kind of rubbing stuff and that. And I think what we're saying to moms is it's not really about the specific thing that you're rubbing with. It can be with your product, the baby product that you're using. It can be with that, but it's really about that touch sensation. It's about that connecting, because you were inside of me, so now another way we can connect is that I keep touching and I keep talking, and I think that's important. But I do think there might be some challenges around what advice you follow.
And also what myths are out there. There's a lot of myths about spoiling baby. People say, well, don't pick up baby too much, but in actual fact, that is a complete myth. You can't spoil a newborn baby.
By picking it up.
Absolutely not. No.
All right. So, are there any other possible factors that would hinder the bond between baby and mom? I know we delved into that it's not natural, but are there any issues around us emotionally, socially, that could possibly hinder the bond between mom and baby?
Quite a lot, actually, that could affect that. We can start off with the pregnancy itself. Some moms really battle with pregnancy. If they have a difficult pregnancy, if they're feeling sick. Some moms feel that the baby is like a parasite inside them, and they really don't feel a sort of a bond at that stage. They don't feel kindly, and that we must normalize that, because that's not always. Sometimes one does feel like that. Then social circumstances, if you've got difficult finances, difficult family matters, difficult relationship with the child's father, teenage pregnancy, the age of the child, the age of the mum, and if there's been past trauma, past depression. And then, of course, if the baby is born with some kind of defect, or if the baby is born very colicky, it's quite difficult to connect with a baby who might be on the autistic spectrum, for instance, who doesn't really take comfort from being cuddled, or a baby who's deaf, or a baby who is who can't see properly. Those are factors that also affect that.
Blanche, you have any additions to that?
No, Julia's covered most of them, because I think all of those things are some of the things we look at in our program, and we call it at-risk factors. So one of the other things we include is if moms have if they have HIV positive as well, as if there's any history of substance abuse, because the attachment can then, the baby could respond differently because of having maybe being drug-induced once born. So we also help mom just to bond, and there's a lot of guilt feelings that could go with that as well. And so we teach mom and support mom through that phase, and also get her the necessary help should she require that.
I'm hesitant to ask the next question, but I also feel we need to be we need to be realistic.
Right.
So here goes. Are there any do's and don'ts when it comes to baby and mom infant bonding? And I'm talking about something as simple as like you've mentioned earlier, and Julia, don't think that cuddling baby is wrong.
Spoiling baby.
Spoiling baby.
Yeah.
So just basic do's and don'ts that you can possibly think of that can help mom and dad, bond appropriately with baby.
Well, when you mentioned dad, and I think do let dad participate as much as possible.
Okay.
For all the viewers out there, I think very often as moms we're already struggling ourselves. It's all overwhelming for us, so we tend to like to take control and feel as though we're in control by not letting anyone else have anything to do, especially dad if he's around. And I think to try and let dad have as much to do as possible with any activity of baby.
I think what's also important is to allow yourself the opportunity to take a break. I think what's important during when you're a new mom, it can be your 7th child, but when you're a new mom, you feel as if this little life is dependent on you. And because of that, I always tell moms that because of they're dependent on you, they need a healthy mom. They need the best you. So if it means you need to ask somebody to watch baby while you take a bath, because I think a bath is something that is a luxury for a mom that maybe has a colicky baby and that cannot put this baby down. But I think that this is an opportunity to actually draw on your support services. Those people who are around you, a gran, a mom, a neighbor if they're a caring neighbor, and actually say to them, can I just grab a cup of coffee? Because that can be important. So just allow yourself that time, because many of the moms, what you do is you go into full mom mode. And then you become so overwhelmed because I have to do the washing, I have to do the cleaning, it's the younger one, I must get ready for school, and I must still sit with this baby. But to actually say to yourself, when baby sleeps, I sleep. And allow yourself
Let
that
the washing
time.
pile up.
Exactly. It's hard, but I'm sure eventually your system will adjust.
And they're not going to be that tiny forever as well.
No, they grow
A
so
year.
quickly.
And
All
it's
right.
about in those tiny moments when they are very small to give oneself permission and to actually be a little bit of a policewoman / man and say, actually, no, I can't take that call now. I can't see you now. I'm with my baby now. That's it.
And be present, as you said earlier on. So there are lots of information available on the World Wide Web. We have all this support as well. We talk about support and we want to latch onto our support. We want to talk about the information available through our support. Granny's advice, mommy's time, dad's possible additions to parenting if you happen to be reading a parenting book. I want to discuss after this short break, so stay with us as we continue Pregnancy to Parenting. Please to interact with us on our Facebook page, Pregnancy to Parenting, and tell us about your parenting skills and how it is that you best feel fit to parent when it came to your first baby, or what you've heard in the grapevine and what could possibly help. It could just help the rest of our Facebook friends of Pregnancy to Parenting. I'm Kawa Solomon. Stay with us. More on mom and infant bonding after this. Assalamu alaikum, a very good day to you. Welcome back. We're broadcasting from Cape Town and the tip of Africa. Shukran so much for joining us and following our show. Please do tell us what you think of the content. Add to possible production that you would like to see on Pregnancy to Parenting. We've dealt lengthy within the pregnancy realm, almost 2 seasons we've covered that. We're now looking at parenting, and firstly, when it comes to parenting, we talk on mom and at least parent-infant bonding. So specifically mom, and realizing, and why we're speaking specifically of mom, because we've just thought that this emotion comes naturally, and we've heard today from representatives of the Parent Centre based out here in Wynberg, Cape Town, Julia Noble, psychiatric nurse, as well as sessional counsellor at the Parent Centre and program manager of parent and infant bonding at the Parent Centre, and that is Blanche Resant. Like geland, Rizant.
Yeah.
That's how I remembered it. Thank you so much, ladies, once again for joining us. We're in our last segment and our last few minutes that we can talk about this. There's so much to talk about. We will leave you a link of the Parent Centre, their contact number on our Facebook page for you to get more information, to try and find out, about a centre close to you wherever you are in South Africa or beyond, to get in contact with information like that, even if it is that you just need to read about it. So let's just continue about the question that I've posed earlier on, and that is with all the information that we have available. And like you said, we need to educate ourselves. We need to be more interactive of the knowledge that is available out there. So yes, there's lots of information on the World Wide Web, as well as advices from grannies, old wives' tales. Tell us how to absorb all of that, but yet still choose a responsible, but yet a choice that works for us between mom and baby, because just as we are different, so is our child different, and we learn through temperament, inshallah, later on in the series. We will find that what works best for me and the type of character that I'm dealing with when it comes to that infant. So guide us with all the information, and respecting the advices as well given by mom and grandmother, because that's actually what worked for them as well.
Exactly.
Yeah, I think what is important is to be respectful of the advice. What I'm also finding a lot is that I'm hearing the term that we have many Google babies around.
Yes.
They call them Google babies, because you kind of Google, you punch into the cell phone and you say what to do when baby is, and there's quite a lot of information there, and I think that's a strength. That parents actually have access, they have access to information, where if you are struggling, that you get some information on what you're struggling with, what you're worried about. What I do think is that it could be an information overload at times, and you really need to look at what is good for, as you were saying, for yourself, what is good for your baby. As we know that no child is the same, and no pregnancy is the same, and no birthing process is the same. So what happens is that you then have to figure out what information I will take and what information I will leave. Sometimes politely saying, thank you very much, mama. I love that information. I will definitely see where I can use it. And if it's not for you, you actually move on and you go with what you're comfortable with. Because I do know there are many moms who are living with their own mothers, who are actually giving the advice and standing there, and really it makes it quite difficult for you to even want to say, this is my child. How do I bring my own style into my own parenting into this relationship?
Absolutely. Sometimes we don't want to perpetuate some of the things that our mothers have done. So, but that is very difficult, and I agree with Blanche that one has to. It's a bit of a balancing act, because if you are living with your mother and your mother is your main support, then it's very difficult to say, actually, no, mom, I'm not going to follow what you're saying, is it? So, so yes, I think we know in a psychological perspective, the 0 to 3 specialised counselling that we do at the Parent Centre that I'm part of, we do see a lot of moms coming in, a lot of parents coming in, and we have a term for that, and that's advised out. They actually, every second person you see in the supermarket, yes, will come and touch your tummy and say you must do this when the child's born, and then when the child's born, they have more advice when you're taking your child in your pram. So I think one of the strengths that I try to reinforce with parents is to say, you are, if you are so lucky just to be the mum and the dad and the child at that point, or the granny and the mum and the child, to say, this is your family. You need to try and sort out what works for you.
Okay, so let's look on the flip side of things when all is going well, and the Almighty has granted you the ability to parent and to create that bond. Naturally it comes, and unfortunately somewhere within the first few weeks or the first few months things now start going wrong. When would you say that one should seek help? Identifying the sort of upheavals you are having, the sort of challenges you are trying to cope with. What would you suggest now? Should you just burn yourself and go through it because you know what, I was able to get through the bonding process with my little one? Please guide us on the possible signs maybe to look out for when one should now seek help.
I think one of the first signs is really a feeling of feeling completely overwhelmed for most of the time. It is normal to feel overwhelmed for some of the time, but if you're feeling overwhelmed for most of the time, then I think you know that something's not right. If you're tearful, if you're crying a lot, if you are having fantasies about harming your child in any way, and of course, you know, that will put the child at risk in some way. So then one needs to ask for help.
All right, and an organization like the Parent Center is one to reach out for.
Definitely.
So thanks to you guys.
Thanks so
All right, so we literally have 4 minutes left, and we've quickly rush through the rest of the information to get out to our viewers. So what happens in the cases where, like I said, all is going well right up until the time, well, actually, all is going well completely, and now you realize, I've got to go back to work, or I've got to go and do my shopping, or I've got to go and drop the other kids or fetch them. So there's that departing anxiety that you now have with baby, and you as the mother now realize, but listen, the baby is now going to be closer to a granny, or maybe even nanny for that matter. Talk to us about those sort of fears and how you guys would suggest to help mom alleviate those fears.
I think if there's a secure attachment, we call it a secure attachment, or a close attachment, and you formed a good bond with the baby, and you feel as though you've been with baby and you understand each other, there's absolutely nothing wrong with that. We're going to be failing our children, we're going to fail our babies in some way, and it's okay for them to form another attachment to someone else, another caregiver, which will add to their life, but it won't take away from the attachment that they have with you.
With mom,
Definitely.
It's going to add, it's not going to subtract. And I think if you have that secure attachment, then you're absolutely fine.
Okay, good. Thank you for that. Right, in conclusion, if I could start with you, Blanche, how to best work on, you know, good attachments and bonding, whether you are mom or dad, and helping also dad through mom, because sometimes you know, dad needs that push, and then also when you are single parenting, or when dad's, you know, there but he's not really present, and how to firstly work on mom and baby. So the best advice going forward.
I think from myself, in our program, what we do encourage is, because we start antenatally, we do actually say that the bond needs to be there. It needs to be a conscious decision that I'm making, that I'm saying, this little life is coming. I'm going to be the best parent I can be. And sometimes there are stresses and strains on a relationship between the parents, whether they're together or not together, and around support the people that are around you. But I think what is important is to understand that there's this life. We always call them mini adults. So we're not always there. This is a person. It's not just another entity. It's not just another attachment. It's a new person coming into a new foreign world for them. And it's about us being the guide. So parenting is really about that from birth, to be that guide for that little one into this world, and to be very mindful of that in everything we do.
Thank you so much, Blanche. Julia, from your psychiatric nurse profession and your counseling background, please guide us as the best attachment, and I think maybe physically looking at how we can attach ourselves and create that positive bond with the infant.
I think from a physical point of view, just the touch, as Blanche mentioned earlier, and allowing ourselves time. Time is very important without any distractions. So stop the cooking, stop the housework, and hold baby close. Look into baby's eyes. Pick up cues. See what baby's feeling. What is baby doing? Is baby moving towards, away, smiling, not smiling, gurgling? And if we repeat baby's verbalizations, if we repeat baby's gurgles, or we smile back, that's one amazing way of forming this incredible bond with baby.
Thank you so much, ladies. Just a telephone number quickly, Blanche, before you run off, and we will put those details on our Facebook page quickly of the Parent Center.
So our telephone number is 021 762 0116. So at any time, if you're looking for support or wanting to know where you can get services, that's important. Or just info@theparentcenter.org.za.
Great stuff. Thank you so much, Julia and Blanche, for your time you've given us today. We hope that it has definitely benefited our community and moms at large. All the best and goodbye for now.
Thank you
Been
for
good
having us
being
here.
That was representatives from the Parents Centre. Please do make contact with them, even if you're anywhere in South Africa or beyond, to find out, you know, who their network is anywhere else out of Cape Town. Hope you enjoyed this edition of Pregnancy to Parenting, talking about parent and infant bonding, specifically with mom. Know that it doesn't come naturally. Educate and find the best advice and ways that you know how to cope with. For myself, Hawa Solomon, wassalamu alaikum, and a very good day to you.